Asthma is a chronic lung disease due to inflammation of the airway, causing hypersensitivity and narrowing of the airway, but the obstruction is reversible. In simple terms, it means that the respiratory tract are often swollen and sensitive. This inflammation makes them react strongly to certain triggers, causing them to narrow and produce extra mucus, which results in breathing difficulties. Asthma symptoms can vary in frequency and intensity. Here are the key symptoms to be aware of. Shortness of breath refers to difficulty breathing, which may worsen with physical activity. Wheezing where there is whistling sound, especially when exhaling. Chest tightness, where feeling of pressure or constriction in the chest. Coughing, especially at night or early in the morning. Fatigue, due to the extra effort needed to breathe. Common triggers include allergens like pollen, dust mites, pet dander, irritants like tobacco smoke, pollution, or strong odors. Cold air and cold drink can provoke symptoms. Respiratory infections such as colds or flu can worsen asthma. Intense emotions or stress can also trigger symptoms. If asthma or allergies run in your family, you may be more likely to develop it. Atopy. Conditions like people with eczema or allergic rhinitis often have asthma. While asthma cannot be cured, it can be managed effectively. Treatment plans generally include medications such as rescue inhalers, refers to short-acting beta agonists, SABAs, provide quick relief by relaxing the muscles around your airways during an asthma attack. Long-term control medications includes inhaled corticosteroids that reduce inflammation in the airways. Long-acting beta agonists that used with corticosteroids to keep airways open. Effective control of asthma depends on multiple factors that interact to influence how well an individual can manage their symptoms and reduce the frequency of attacks. One, adherence to treatment by consistently taking prescribed medications, such as inhaled corticosteroids or rescue inhalers, is crucial. Skipping doses or not following the prescribed regimen can lead to poor symptom control. Proper inhaler technique by using the correct technique is important to ensure that the medication reaches the lungs effectively. Incorrect technique associated with worsening of asthma control, higher rate of instability, and increase the need of reliever. The steps for correct inhaler technique are: first, shake the inhaler. Second, seal the lips tightly around the mouthpiece. Thirdly, inhale slowly and deeply while pressing the canister. Hold your breath for 10 seconds, keeping your mouth pursed. Then exhale. Don't forget to rinse your mouth at the end if you are using inhaled corticosteroid, as it can cause candidiasis, which is a type of fungal infection. Recognizing personal triggers, such as allergens, irritants, cold air, or exercise-induced triggers, and taking steps to avoid them can greatly improve asthma control. Maintaining a clean living environment and reducing exposure to irritants can help minimize asthma exacerbations. Regular monitoring and follow-up by using asthma diaries to keep track of the symptoms to know if the asthma is well controlled. Regular appointments with a healthcare provider allow for adjustments in the treatment plan as needed. Overall lifestyle changes like regular exercise, a healthy diet, quit smoking, stress management contribute to better overall respiratory health.